Hello, you're welcome to the teacher channel and welcome to this presentation, First Aid for Choking Emergencies. So please, I'm going to ask you to subscribe to this channel if you have not. Like the video, share the video, comment on the video, and also turn on your notification bell. And I really appreciate that. Thank you so much. The agenda for this presentation: what is choking, types of choking, signs and symptoms of choking, first aid for choking, prevention of choking. What is choking? Choking is an airway obstruction by a foreign object. Example is a piece of wood. An airway obstruction by a foreign object, and the example of a foreign object is a piece of wood. So let us look at basic anatomy of the airway and the surrounding tissues and structures. As you can see, esophagus is a hollow muscular tube that carries food and liquid from the throat to the stomach. Then trachea is a long tube-like structure that connects the voice box to the lungs. As you can see, trachea there. Choking occurs when what should go to the stomach goes towards the trachea and blocks it either partially or completely. So choking happens when what is supposed to go to the stomach now begins to go toward the lungs. And that object, that piece of food or whatever that element is or that substance is, can block that airway either partially or completely. Types of choking. So we know that choking is airway obstruction. So there are two types of choking from this structure, this tree-like structure. So it's a partial obstruction, and partial obstruction will lead to mild choking. And then there is complete obstruction. So when the piece of food or that foreign object completely blocks the airway, that will lead to severe choking. And then when somebody is severely choking, there are two states. Either the person is still conscious. Initially, the person will be conscious, but as time goes on, if that foreign object is not expelled, is not removed, the person will go unconscious, or the person becomes unconscious with the time if the object is not removed. Signs and symptoms of choking. For mild choking, loud cough is usually present. The person is able to make sound or speak. The person's face may turn red or flushed. Watery eyes are possible. Wheezing or gagging may be experienced. Throat grabbing with the hands. Throat grabbing with the hands. So the person may actually grab the throat. So let's see the signs and symptoms for severe choking. Weak cough or no cough at all. High-pitched wheezing cough. Can't make a sound or speak, so the person may not be able to. The person cannot make a sound or speak. Blue to gray face in terms of color. Panicky eyes is showing fear, showing that the person is really afraid. So those are the signs and symptoms. And then the last sign and symptom on that list is grabbing the throat with both hands or with one hand. So on the left side are the signs and symptoms for mild choking, loud cough. The person is able to make sound or speak. The face may be red or flushed, watery eyes, wheezing or gagging, throat grabble with the hands. And then on the right side are the signs and symptoms for severe choking, weak cough, or the person will not be able to cough at all. High-pitched wheezing cough. The person can't make a sound. The person cannot speak. Blue to gray face. Panicky eyes. And the person may grab the throat with one hand or both hands. Let's see first aid for mild choking. Perform the scene survey, because that is always the first step when you do first aid, the scene survey. And the scene survey activities include check safety, ensure personal protection, obtain permission, then encourage the victim to continue to cough. So remember that when somebody is mildly choking, loud cough is present. So since this person is already coughing, which is necessary to clear the airway, encouraging that person to keep on, to continue coughing is actually the best first aid to do when somebody is mildly choking. Call 911 if forceful coughing does not help the victim. So if the person, after being encouraged to cough and the person has been coughing forcefully, and despite all those, the person is not helped, then calling 911 is a very good idea, and that is encouraged. Continue ongoing patient care while encouraging the victim to cough. You have to monitor the person's airway, breathing, and circulations, ABC. You have to also reassure the patient. First aid for severe choking. If the patient is a baby or an infant and that baby is still conscious, hold the baby first down and head slightly lower on your forearm. Ensure baby's neck and head are supported. So by making a V with your thumb and index finger on the chin of that baby, this is the way to support the neck, which is very, very fragile, and the head. Both of them must be supported. Rest that arm, the arm that is holding the baby. Make sure you rest it on your thigh for leverage. Use the heel of your hand to deliver 5 back blows between the baby's shoulder blades. So the heel of the other hand, 5 back blows between the baby's shoulder blades. Then after the 5th blow, back blow, you turn baby on the other arm, turn baby up, face up, and again use your thigh for leverage. And make sure that the neck of the baby is also supported. Use 2 fingers to give 5 chest thrust just below the nipple line. So face up position, head, neck slightly lower. Then with 2 fingers, give 5 chest thrust at the center of the baby's chest. Repeat steps 1 to 4 until the baby cries, breathe, cough, or the baby becomes unconscious. So either the object is expelled, or with time, this baby will go unconscious if the object refuses to leave. Severe choking. Unconscious infant. So the infant has become unconscious now. So let's see what should be done. Remember that when this baby was conscious, you give 5 back blow between the shoulder blades, and then 5 chest thrust at the center of the baby's chest using 2 fingers. And you repeatedly do that. You alternate that. Hopefully the object will pop out and baby will cry or cough and begin to breathe. But if that does not happen, the baby will go unconscious. And so let's see what happens when the baby goes unconscious. Yell for help and dial 911 or your local emergency number. So you have to yell for help and dial 911 or your local emergency number. Ask to bring an AED, that is an AED. Lower the baby in a hard, flat, or firm surface in a supine position. Perform 30 compressions at the center of the baby's chest. Open the baby's airway. You do head to chin lift and look for the foreign object. Remove the object with a finger swipe if visible. If you see the object, remove it. Try to give 2 breaths, watching for a visible chest rise. Okay. Continue to give high quality CPR until the baby starts to respond or the EMS takes over from you. First aid, severe choking, conscious child or adult. Confirm choking by asking, are you choking? Ask for permission if the victim nods the head, because the victim cannot talk. Emphasis here, verbalize every step to the patient. So you need to let the patient know every step you are going to go through. Stand behind and slightly to the side of that consciously choking patient or victim. You may need to bend if a child victim. So you may need to bend. You may need to lower your height for a child. Support the upper part of the victim. Bend the victim forward from his or her waist. So with that support, usually you do the support by putting your hand across the shoulder and lean the person forward to expose the shoulder blade. And then with the heel of your hand, the other hand, deliver 5 firm back blows between the shoulder blades. And then proceed to step 5 if the foreign object does not go away. So usually with 5 back blows between the shoulder blades, the object can pop out. But if the object does not pop out, if the foreign object does not pop out, does not go away, then we move to next step. So step 5, move behind the patient. Place one foot in between the victim's legs for support. Make a fist and place the thumb side above the victim's belly button. Place the other hand on top of the fist. Deliver 5 forceful thrusts in and up motion. Repeat steps 3 to 8 until the foreign object goes away or the victim becomes unconscious. So with a series of 5 back blows and 5 chest or 5 abdominal thrusts, but if the person is obese, let's assume, or the person is visibly pregnant, you may do 5 chest thrust instead of abdominal. So when the person becomes unconscious, again, yell for help and dial 911. You need an AED. Gently lower the victim onto the ground in a supine position and start a high quality CPR. Start with 30 compressions at the center of the victim's chest. Open the victim's airway, do head to chin lift and look for the foreign object. Remove the object with a finger swipe if you see it clearly. Try to give 2 breaths, watching for a visible chest rise. Continue to give high quality CPR until the victim starts to respond or the EMS takes over from you. Prevention, how to prevent choking. Children should be supervised while eating. Eat slowly and chew food properly. No physical activities while eating. Avoid eating while driving. Large amount of alcohol should not be consumed before or during meals. The reason alcohol impairs muscle reflexes. Talking, laughing while eating could be dangerous, and it is a good thing not to talk or to minimize talk, minimize laughing while eating, because that could be dangerous. Thank you for watching. You can email us at theteacherchannel@gmail.com. Again, please subscribe to the channel, and thank you so much for watching.